Do you know how much time a doctor spends charting for each patient encounter? We need to make it easier for them. Hey everyone, welcome to Healthcare at the Edge, where we explore the intersection of healthcare and technology. My name is Samuel, and today we're going to look at how much time a physician spends in the electronic health record for each patient visit that they have, for each patient encounter. There was a recent study that came out last year, actually, in the Annals of Internal Medicine that cites that a doctor on average spends about a little over 16 minutes, almost 17 minutes in the electronic health record for each patient encounter. And now you think about that, especially in the fee for service model that we have today, which is doctors get paid and we can reimburse based off of the number of patients that they see in a day. And so for them, if they see, a lot of patients in a day, and each of those patients requires on average about 16 to 17 minutes worth of charting time. And now they broke up that time. They looked at it and said about 33% of the time they spent in the chart was to review, was to look at, past history, other pieces to make sure they understand the patient's condition, which is very valuable. The second part would be writing orders. And the third part would be to dictate or write notes or update and do the different charting to narrate the clinical encounter. And so there's a lot of time that the doctors spend in the electronic health record. Well, what if we could make that easier? How would you feel as a patient if you knew your doctor was receiving assistance from some artificially intelligent, natural language process, chatbot, some type of structural systems to make that doctor's life a little bit easier so that they could have the information readily available? So when the patient says, "Oh, I have a history of high blood pressure," the chart would automatically pop up the pertinent information for the doctor to see of what medicines that they're taking for that, how long has this been diagnosed, what's been the course of treatment, has there ever been a tracking study to follow their blood pressure over a period of time. And so the doctor wouldn't have to necessarily review that information before going into visit. They would have it given to them as the patient is discussing their past pertinent medical history for whatever their reason for visit is that day. How would you feel about that? I mean, do you know that? I mean, that's something you think about. You go to see a doctor, and obviously we understand our doctors and care providers, they're experts in their field. They have trained and studied and practiced for, many of them decades to be able to provide the level of service that we come to expect as patients. That's why we go see them. We're imparting a level of trust in that training and that education and in that practicing that they've been doing. However, how would you feel if you knew the doctor was actually relying on a computer to do a lot of their thinking and legwork for them? I mean, I would want my doctor to have reviewed my medical history when I'm seeing them to discuss whatever complaint that I'm in the office to be seen for. That seems like a normal thing that, we would come to expect as humans. Or for me to be able to have the space to explain why I'm there, the pertinent things about the reasons for my visit, or whatever it is. And we want our doctors to be attentive to those conversations, and we want them to have all of the information possible. There's things that are really important, especially in some complex medical conditions that require a lot of management. There are lots of contraindications, lots of different avenues and courses and changes that a doctor can have, which will be based off of information, either in the medical history, the past, the stuff leading up to the complaint. And if we could use technology to better provide information to these providers and really start lowering the amount of time they have to spend into the medical record. This is a new thing. It's kind of a future state of hospital-based healthcare, which they're calling a next generation patient room, where the doctor will be able to go in and without having to sit behind a screen and type, they can actually sit with their patient, have a conversation, an actual care provider and patient conversation, which we all, I think as human beings, we deeply crave. We want to know that the expert we're turning to for help in whatever time that we have need of them is someone that actually is able to be a human being, to respond in an empathetic, caring, and knowledgeable way without having to spend all their time, clickety-clacking on a keyboard. So let me know your thoughts. I want to hear from you guys what you're thinking about using artificial intelligence, machine learning, natural language processing to, help doctors better review medical data. On one hand, some people might say, well, it'll just make them reliant upon certain technologies so that they're actually not doing the hard work of, case review, chart review, medical history review, so that they are prepared to walk into that patient encounter with knowledge and backstory. On the other hand, I might say, we're going to free up a lot of time for these doctors to focus on, things that are actually important, other patients to see or other things like that. So a lot of conversation here, but long story short, we've got to do better about helping the workflows for doctors inside the electronic health record and nurses. Don't leave out the nurses and other health professionals in this too. Their workflows can be astronomically difficult as well. So we've got to make them easier, more intuitive, better able to understand. So instead of hunting and finding whatever click they need to do next, information can be intuitively gathered and provided for them. So much work to be done, but this is an area that AI is showing some strides. We have a lot of technology that has been proven in a lot of other areas. Call centers have been using natural language processing very effectively for many years to help deliver pertinent, just-in-time information for their agents as they're caring for customer complaints or issues. So there's no reason to think we can't transfer some of that to the healthcare field. The stakes are a little bit higher dealing with people's medical care. So let me know your thoughts. I want to hear from you about this topic because it's something that's where we're going, but we got to make sure we do it the right way. And as always, I look forward to your comments, concerns, challenges, and your critiques. And we'll see you tomorrow.